So people can listen to this and we can forward it to our customers that are unable to join. I want to introduce our speaker, Stacy Barrow with Barrow, Weatherhead and Lent, a boutique employee benefits executive compensation and employment firm located in Boston. Stacy's been licensed to practice law for over 20 years and has been practicing law in private practice for over 15 years. He uses a practical, business-focused approach to counsel his clients on complex employee benefits and executive compensation matters. Stacy has extensive technical knowledge and experience designing and implementing health and welfare plans that meet the numerous and intricate requirements of the state and federal law. During this webinar, we'll be discussing the impact of the end of the COVID-19 national and public health emergencies on group health plans. And Stacy will also be sharing insights on what employers can do to navigate this changing landscape and keep their employees safe and healthy. With that, I'm going to hand it over to you, Stacy.
Thanks, Nicole, and thanks everybody for joining. So as Nicole said, today is talking about the end of the COVID-19 disaster relief, the relief that the Employee Benefit Security Administration, which is part of the Department of Labor, granted back in March of 2020, the national emergency and the public health emergency. And we'll also talk about the Medicaid redeterminations that will be occurring during the rest of 2023 and the impact that it may have on group health plans. And then a couple of other items, related items, the telehealth safe harbor for HSA plans, a new law that's been introduced to make telehealth more easily available, as well as some news on the enhanced premium tax credits and a new e-filing requirement for next year. So just as a little bit of background, this guidance, I said March, but I guess it was April. In April of 2020, the agencies, Department of Labor, HHS, and IRS, released some regulations in light of COVID that gave participants in ERISA plans additional time to notify the plan of certain events and to do things like engage in claims and appeals process. So specifically, the agencies granted extensions starting from March 1st of 2020 until 60 days after the end of the national emergency. I think at that time we were anticipating the national emergency to end, within a month or two. The original examples that the Department of Labor provided back in 2020, I think, had the outbreak period ending in July of 2020. So, here are the deadlines that are affected. So we have the 30-day period to request a HIPAA special enrollment, which occurs when there is marriage or birth of a child or adoption or a loss of other coverage. And there are also the Medicaid events, which provide a 60-day special enrollment window. So these deadlines were extended during the COVID period. It's not every change in status event that was extended, just the HIPAA special enrollment events. We also had the 60-day period for electing COBRA coverage, the 30-day deadline for paying for COBRA coverage. There's 45 days for the initial premium payment. There's also the 60-day deadline to notify the plan of a qualifying event, like aging out of the plan or divorce, or a determination of disability. Likewise, the deadlines to file claims and appeals under a group health plan, including a health FSA, or a disability plan were extended, as was the time frame within which you need to extend an external review. So some of you may have felt the impact of this with health FSA plans, where vendors weren't really sure how to administer things like carryover when participants, have not just 90 days after the end of the plan year, but a whole additional year to submit claims. So these are the timeframes that were extended during the national emergency, and the Department of Labor later clarified that this relief can extend until the earlier of 1 year from the date that someone is first eligible for the relief, or until 60 days after the end of the COVID-19 national emergency, which is the end of the outbreak period. This relief applied not only to employees and plan participants, but also to employers and plan sponsors. Under this relief, plans were relieved from most ERISA Title I requirements to timely furnish things like an SPD or a COBRA notice if the plan is acting in good faith, and then furnishes the documents as soon as practicable under the circumstances. Examples of good faith acts include use of electronic communications when available, when the employer reasonably believes that participants have effective access to that electronic communication. So this was handy not only for plan participants, but for employers as well. If you were a little late on COBRA notice, say, you should have regulatory relief here. One of the Title I requirements that wasn't really affected was Form 5500 filings. There was some brief relief in 2020, but in general, the 5500 forms don't benefit from this particular relief, even though they're a Title I disclosure. So the national emergency is ending May 11th of 2023. There was a final extension in January by the president via a statement of administration policy that was kind of vague, it hemmed and hawed a little bit, but essentially ended the national emergency May 11th, which means the outbreak period ends 60 days later on July 10th. Now, after the statement of administrative policy, the president signed on April 10th, signed into law this House Joint Resolution number 7. And that officially ended the national emergency on April 10th, about a month and a day earlier than was anticipated back in January. However, the Department of Labor, prior to April 10th, issued FAQ guidance. They issued it on March 29th, about 11 days earlier. And in that guidance, they referred repeatedly to the May 11th end date for the national emergency and the July 10th end date for the outbreak period. And they've informally indicated that despite House Joint Resolution number 7, they're sticking with the May 11th end date for the national emergency and the July 10th end date of the outbreak period based on their prior published guidance. So tend to think following that later end date is the best approach. And so here are some examples of how the deadline extensions work. And we have some dates here that are in 2023 that are closer to the end date of the national emergency. So these ones involve COBRA, electing COBRA. And the example is you have an individual who experiences a COBRA qualifying event and loses coverage on April 1st of 2023. They are provided a COBRA election notice a month later on May 1st of 2023. So their deadline to elect COBRA is 60 days after the end of the outbreak period. So 60 days from July 10th, which is September 8th of 2023. And that's because they experienced a qualifying event during the national emergency. Now, take the same facts as previously, except the qualifying event and the loss of coverage occur on May 12th, which is one day after the end of the national emergency. And then you have the election notice provided a few days later on May 15th. Here, the deadline to elect COBRA is 60 days after the end of the outbreak period, that September 8th date, because the qualifying event occurred after the end of the national emergency, but during the outbreak period. So you still get that extension to July 10th. And then you start counting your 60 days. Now, last example is a little different. We have the qualifying event and the loss of coverage occurring July 12th, and the COBRA notice is provided 3 days later on July 15th. Here, the deadline to elect COBRA is 60 days after the date the COBRA notice is received, 60 days after July 15th, which is September 13th. And that is because the qualifying event occurred on July 12th, which is after the end of the outbreak period. So, you can see basically for events occurring after July 10th or 11th, we're kind of back to normal for things like electing COBRA, paying for COBRA, and HIPAA events. So here's another example with paying for COBRA. You have an individual who has experienced a qualifying event, and they receive a COBRA notice on October 1st, 2022. They elect COBRA on October 15th, retroactive to October 1st. So they elect right away, and their coverage is retro to the date of the qualifying event. Now, they have until 45 days after July 10th, which is the end of the outbreak period, takes them to August 24th of 2023 to make that initial premium payment. And that includes all of the months from October 2022 through July of 2023. And then the August 2023 payment is due at the end of August, which is the last day of the typical the standard 30-day grace period that applies now that the national emergency and outbreak period have ended. Similar examples for the HIPAA special enrollment events. You have an employee who waived coverage previously, and she gave birth to a child on April 1st of 2023, and she's requesting special enrollment rights for herself and the child. In this example, the employee can enroll herself and the child until 30 days after July 10th, which is the end of the outbreak period, as long as she pays all of the premiums for the coverage retroactive to the date of birth. Same outcome if she gave birth on May 12th, which is the in between the end of the national emergency and the end of the outbreak period. She would still have 30 days from the end of the outbreak period. And then if the birth occurs on or after July 12th, say, or the 11th, then she has 30 days special enrollment event back to the date of birth. Okay. So that'll all return to normal later this summer, early fall. And then we have the other part of the disaster relief, which is the public health emergency. The public health emergency affects certain plan design provisions, and that one ends May 11th, regardless of that joint resolution I talked about earlier. There's no controversy there. This one simply ends May 11th. And during the public health emergency, plans have to cover COVID-19 testing, whether it's over the counter or in person, without cost sharing and without prior authorization. And then during the PHE, they also have to cover COVID-19 vaccines, even if they're received from out-of-network providers. And so once the public health emergency ends, plans can once again require prior authorization or copays for COVID-19 testing, and they can impose cost sharing for out-of-network COVID-19 vaccines. When you get the vaccine from an in-network provider, that is still covered at no cost. So despite the PHE ending on May 11th, the agencies encourage plans to continue to provide COVID-19 testing coverage without cost sharing. They remind you in the FAQs that the plan must use the date of service, not when the claim is submitted, when determining if an item or service was provided during the public health emergency. We've also seen a number of plans and carriers inform participants that once May 11th rolls around, they're going to revert back to pre-COVID plan design and not cover any of this testing or out-of-network vaccines without cost sharing any longer. The general rule, again, is that you have to notify participants if you're going to be doing this mid-year. The ACA rules generally require a 60-day advance notice to be provided when there's any change that affects the content of the plan's current summary of benefits and coverage. But the agencies are waiving that advanced 60-day notice requirement for any COVID-19 related changes that are made due to the end of the public health emergency if you've either notified folks already of the general duration of the additional benefits that you're providing, or you notify them now in a reasonably in advance of the time you're going to revert back to the prior plan design. And the agencies note here that you can't rely on a notification provided in a prior year. It must have been provided during the current plan year in order to qualify and allow you to avoid the 60-day advanced notice rule. So here's a piece that I think is interesting. It's not exactly connected to the public health emergency. It's part of the Consolidated Appropriations Act 2023 changes that were made. And this is the end of the Medicare continuous enrollment provision that actually ended April 1st. And it'll be phased down through the end of 2023. And what this did, this continuous enrollment provision, was that it kept people enrolled in Medicaid for the duration of the public health emergency. And so for the last few years, the Medicaid rolls expanded significantly. So now we're up to something like 95 million adults and children covered by Medicaid in March of 2023, right before the redeterminations began. So, like I said, the Medicaid rolls have swelled over the last few years, partly and due to the continuous enrollment provision, also partly due to the economy, as well as more states expanding Medicaid under the Affordable Care Act. And so enrollment went up something by like 21 million participants between February of 2020 and December of 2022. So this is the first time then in more than 3 years that states will begin re-verifying whether people are still eligible for Medicaid. And so this is anticipated to result in millions of people losing coverage under Medicaid. They're thinking that maybe 4 million of them might move to an employer-sponsored plan, but upwards of 15 million people may lose eligibility, a lot of times due to administrative hassle and not getting proper communications or getting inconsistent communications. There'll be people that lose it for some family members and not others. And for a lot of folks, the first time they find out that they've lost Medicaid is when they go to the emergency room. So, this is very likely, I think, to ultimately have some kind of an effect on commercial plans and private plans that end up picking up some of the costs when there's overutilization of uninsured folks of the ER. So this will be something that we'll be watching for the remainder of the year. And then one more note about that, just be aware that when participants seek to enroll because of a loss of Medicaid or a gain of Medicaid premium assistance, they have 60 days to notify the plan. A lot of times these notices are sent out a bit late, and so the agencies are encouraging folks to perhaps amend your plan and provide additional time if you have people you think might be coming off of Medicaid. Other relief for HSA qualified plans The FAQs also note that, at least for the time being, high deductible plans can continue providing coverage for COVID-19 testing or treatment without cost sharing prior to the deductible, without disrupting HSA eligibility. And any future guidance that they issue won't require plans to make mid-year design changes in order to maintain their HSA qualified status. Other HSA related relief, not exactly part of the public health emergency, but it is part of the last couple of Consolidated Appropriations Act. And that is a safe harbor that allows HSA qualified high deductible plans to offer no cost telehealth benefits without disrupting HSA eligibility. And this applies to not only virtual primary care, but virtual behavioral health as well. This has been in effect for the last few years. We'll have it for 2023 plan years, as well as 2024 plan years. It's currently under a 2-year extension. I tend to think this one will get extended again, maybe for another 2 years after 2024, maybe eventually made permanent. But this safe harbor, if nothing else, is clear guidance that without the safe harbor, the IRS tends to think that providing no-cost telehealth benefits would disrupt HSA eligibility. We also have a new bill that was introduced and was heard on the Hill last month, arguments on the Hill, and that is the Telehealth Benefit Expansion for Workers Act of 2023. That's HR 824. It was just introduced in February, and it would greatly expand the availability of telehealth. It would basically classify telehealth as a HIPAA-accepted benefit, which would result in it being regulated similar to dental or vision coverage, where you can offer dental or vision coverage regardless of whether employees are eligible for your group health plan or any other plan. So this likewise would treat telehealth plans that way. You could offer standalone telehealth regardless of size and regardless of whether the employees are eligible for or enrolled in other medical coverage. And again, this is a pretty significant expansion over current relief. You may not know there's a very modest relief that was passed a couple of years ago that allows large employers, and only large employers, to offer standalone telehealth benefits to non-benefit eligible employees. And of course, you can also give it to employees enrolled in your medical plan, but this provided a little bit more flexibility. And the reason they did it this way is that they didn't want employers to provide telehealth in lieu of group health plan coverage. So they're limiting it to large employers and only then to non-benefit eligible employees. But this current bill would expand it well beyond that, and we'll be keeping our eye on it in 2023. Another kind of related law that I want to mention real quick is the Inflation Reduction Act of 2022, as it expanded the ACA's premium tax credit program at least through 2025, and we'll probably get this extended after 2025 as well. And the way this works is that it makes the ACA's premium tax credits more economically valuable to participants. You'll be able to get a premium tax credit as an individual, even if your income is over 400% of the federal poverty level, as long as you're not offered affordable employer-sponsored coverage or eligible for Medicare, and the cost of the second lowest cost silver plan exceeds 8.5% of income. So this basically opens up a greater avenue for more people to get premium tax credits, which could trigger penalties on employers if they're large employers and they're not offering affordable coverage. And then we also have the IRS fixing the so-called family glitch under the ACA, which will also result in more family members being eligible for premium tax credits. So could be a little disruptive to employer plans. You can see here, the top chart is the subsidy percentages pre-ARPA. You can see, say, somebody that was earning between 200 to 250% of the federal poverty level, they would be required to pay anywhere from 6.52% of their household income to 8.33%, depending on where they fall in that range. But now under the Inflation Reduction Act, that percentage is cut by more than half. It's cut to 2%, looking again at the 200% to 250% bracket, 2% at the low end and 4% at the high end. So again, several million more people will qualify, sorry, missed the slide, will qualify for premium tax credits. So you can see the differentials here. And then lastly, just wanted to remind everybody of this new e-filing requirement for next year. Most employment tax related forms will have to be filed electronically next year. This is part of the Taxpayers First Act that was signed into law back in 2019. And it'll include things like employment tax returns, information returns like your Form 1099s, W-2s, and the ACA forms 1094C and 1095C, among others. And so this is triggered by any company that has to file 10 or more returns in a calendar year. The threshold previously for filing was 250 forms. And this includes partnership returns, corporate income tax returns, UBIT, although it does not apply to forms 940 and 941. Those are about the only ones that get a pass. So not only is the threshold 10 forms, but you have to aggregate all of your forms to see if you hit the 10 form threshold. So if you have 5 W-2s and 5 1099s, you have 10 forms and all of those must be filed electronically. The way that it worked previously was, it was 250 forms for the threshold and it was separated by type. So if you had 200 W-2s and 200 1099s, you could file those all by paper if you wanted to. But starting in 2024, for the 2023 tax year, all this stuff's going to have to be electronic. So again, just make sure that you have a good ACA reporting vendor in place for 2023 if you are a large employer, because you will have to report electronically. Likewise, even if you're reporting 1095B forms, if you have more than 10 forms to report in total between your B forms and your W-2s and all that, then you also have an electronic reporting obligation. That takes us through the end of my slides, Nicole. I said it would take about a half hour.
Yeah, you're spot on. I don't see any questions in the chat box. Thank you again so much for hosting this call for us and our customers. BCI team members, I will be sending this out, and this will be included in our next newsletter that is sent to our customers, a copy of this recording. And if you have any questions on what's been presented by Stacy, please feel free to reach out to myself and or Stacy, and we can help get any answers to any questions that you have. Thank you, everyone.
Thanks, everyone. Take care.
Bye.